Hi, everyone. This is Rajesh Sivamani. I'm one of your co-hosts for the Women's Health Summit, along with Ann Kennard. And I'm here today with Dr. Sarah De La Torre. She's a board-certified OB-GYN. And we are talking about photobiomodulation, vaginal health, and she's the expert, and she's going to give us some of the clinical pearls about what we can do about and what are the options. Sarah, welcome to the program. Really appreciate you being here.
Thank you. I'm really happy to be here.
Can you give us a little bit of a background about yourself? Because, when we were talking earlier, you're doing some training beyond what we get in standard medical school, which I think is pretty cool. I'm excited about that. So if you don't mind talking a little bit about, what you're doing, and then tell us about, where you're headed with your career as well.
Yeah, sure. So I've been an OB/GYN for 20 years. I'm a North American Menopause Society certified. So that means I'm a specialist in menopause and treating women who are in menopause. But recently, a couple of years ago, just aspects of conventional medicine started to frustrate me, that I felt like I couldn't treat women entirely the way I'd like to. And so I decided to obtain more training in something called functional medicine. And that looks at the root cause of health issues that we may have and kind of takes more of a broader lifestyle approach, as opposed to just sort of, here's a pill, take an aspirin and call me in the morning. It's sort of, well, what's your stress level? What are you eating? What's your environment, and any toxins in your environment, and how's that affecting your health?
Now, how did you get interested in that? Because I can share that, I had the same experience myself when I went through medical school. I thought it was wonderful training. But I definitely thought there were some areas where I couldn't connect with my patients as deeply as I was hoping to. What got you thinking about functional medicine in particular versus, other kind of training modalities that would have been available?
Well, I think specifically dealing with perimenopausal and menopausal women, and women who would come in their early 40s and complaining of menopausal symptoms. And they were pretty young to be having them, even though perimenopause does start as early as 35, but they're having pretty significant symptoms. And I kept thinking there must be something else besides just giving her a hormone patch or a pill. And just digging into more learning about the adrenal glands and sort of how our systems all function together. Conventional medicine tends to say, okay, here's the gynecology and here's the hormones, and just sort of separates things out when our bodies function as a whole. And so just listening to women and not being able to effectively treat them just with hormones and without approaching their lifestyle issues is what made me sort of lead to digging deeper into different types of medicine.
Yeah, I think that's really a very interesting thing that you point out, because we do try to, sometimes there's this artificial separation. Well, speaking on the topic of menopause and changes that occur with health as well. Today, we're going to be talking a bit about what are some of the changes that come with aging, sexual dysfunction, stress, incontinence. Can you talk about what are some of the issues that women face, especially after childbirth and menopause?
Yeah, yes, absolutely. So women have, if we just think about the pelvic floor, and let's take hormones in sense of hot flashes and mood swings. Let's just put that aside for a minute, because that's a whole nother topic.
No, that's a good point. We're talking more, pelvic floor.
Yeah. So for just specifically the pelvic floor, women's pelvic floors take a lot during their lifetimes. Carrying a child itself, not even having a vaginal birth, because women with C-sections often suffer from pelvic floor disorders even though they don't have a vaginal birth. So carrying a child, having a birth, specifically a vaginal birth, and then changes that come with age. And as our, just like in our faces and our collagen and our skin starts to break down, it starts to break down in our vaginas as well. And there's muscle damage, nerve damage, all that with childbearing. And then add on to that hormonal changes that happen in perimenopause and menopause, where our estrogen levels fluctuate and then go down significantly after menopause. And that really affects the vaginal lining. It leads to dryness. It leads to dyspareunia, which is painful intercourse. Stress incontinence is when women leak, with sneezing or coughing. And then also overactive bladder. So all these issues that women face are due to just aging, childbearing, and then hormonal changes with menopause.
how common are pelvic floor changes? Is this something that's very common, somewhat common? Just want to paint a picture on how often you see these sorts of issues.
It's very common. Yeah, daily in my office, I would say I treat women who have one of these issues. And some women just have an isolated issue of stress incontinence. Other women have the whole, they'll have prolapse and stress incontinence. And then in menopause, they have dryness. So it varies by how much or how many issues that they do have. But over 100 million women globally, so around the world, suffer from some sort of pelvic floor disorder. So it's very, very, very common. Approximately, I would say 30 to 50%, depending on the literature and what you're reading, suffer from stress incontinence. I mean, if you think 1/3 to half of women have issues with their bladder and how frustrating that can be and how it affects their lifestyle. So it's a very prevalent problem.
Yeah, I mean, it sounds like it's very common. Well, that leads to the next question, which is, of course, they're coming with these issues. What are treatment approaches and what are some of the things that you talk to women about when you're addressing this?
One thing I didn't mention, which is also a very important part of, it's not necessarily a pelvic floor disorder, but sexual dysfunction encompasses pelvic floor disorders, but also it can be an emotional and mental thing as well. But sexual dysfunction is also very common. And again, in the literature, it's a very wide range. It's again, something like 25 to 65% of women suffer from some form of female sexual dysfunction. What that means is that they either have trouble with desire, arousal, libido issues, or they have painful intercourse, they have relationship issues. So it covers all forms of dysfunction. And it's really only a dysfunction if it bothers the woman. If it doesn't bother her, then it's not technically a dysfunction, but plenty of women have that issue as well. And that's something that needs to be addressed, I think, more publicly. And one more point I want to go into before we move on is that, interestingly enough, women don't bring this up on their own frequently. I think there's some embarrassment. It's a private issue. And even though they might talk about it with their girlfriends a little bit, I found that I have to initiate the conversation with patients about either female sexual dysfunction or pelvic floor disorders for it to really be out in the open with them.
What you're saying resonates even with myself because in dermatology, I see a lot of women for a few conditions that do affect them, their sexual health. I mean, if it's like very bad psoriasis or
Right.
hidradenitis, which leads to a lot of kind of private suffering. You're totally right. They won't bring anything up. And sometimes I'll bring it up to them and they'll say, hey, you're the first one that even asked me about this amongst my doctors. So I really appreciate you making that point because I know amongst men, it's a big thing too. They don't always bring it forward, but I think I really appreciate your point there. So how do you open up that conversation? If you're going to talk about sexual dysfunction or sexual health, what do you think is the best way to open up that conversation?
So I think for family medicine and OBGYNs, it's probably easier because we do approach these issues more commonly. But for people who might be interested in photobiomodulation, which we'll get into later, such as dermatologists or plastic surgeons, there's less access to those conversations. So questionnaires might be helpful where a woman can just fill it out privately, like a review of systems, sort of an idea where you can ask very specific questions about their sexual function and or their pelvic floor. Do you leak? How often? Is it bothersome? There's great validated questionnaires out there that are very short. Female Sexual Function Index, the Urinary Distress Index, those are 6 questions. You can shorten them if you want to, but very easy to access them and use them with patients. Verbally, though, with them, I'll just say, how's your sexual life? How are you feeling about it? Are there any issues that you want to talk with me about? With pelvic floor, you can start more medical. Do you have pelvic pressure? Do you notice anything coming out of your vagina? Do you have any concerns? So probably the more straightforward you can be, the more comfortable I think the patient can be, because you make it sort of more of it's a medical issue. It's a health concern that you may have, and we can address any health concern.
Great. So then thinking about treatments, I know there's a range of treatments. We were going to get into photobiomodulation, but can you go over what, I mean, are there any lifestyle treatments that you incorporate when you talk to women about this? And then what are some, other maybe procedural approaches that you can take?
Yeah, so with pelvic floor disorders, let's put female sexual dysfunction aside for just a moment. But for pelvic floor disorders, most physicians are, and women too, are familiar with kegels, and there's lots of jokes that women make about doing their kegels. But kegels can be quite effective, and you can note in the literature, again, it'll say about up to 50% reduction in stress incontinence if women are very diligent about them and do them routinely. Most women don't actually do them correctly, so it's important to make sure they're doing them correctly and then describe how to do it. Pelvic floor physical therapy is another great modality, and the combination of PT and at-home exercises has been shown to be effective. Most women, though, are pretty busy. They don't want to go see a PT about issues such as this, again, because of embarrassment or just privacy issues. And oftentimes they don't do their kegels correctly or do them enough. Medications exist, again, not for stress incontinence, but for overactive bladder, but they do have some side effects, dryness of the eyes and the mouth. And there's many excellent pelvic floor surgeons who can treat prolapse and stress incontinence. But there's debate because, the FDA just took the mesh off of the market. And so it's difficult to treat now. And there's lots of controversy about the mesh, but surgery was an option and still is, but that's quite drastic and lots of side effects and potential for needing more surgery in the future. With female sexual dysfunction, the FDA has not approved any in-office procedures that we have. And those in-office procedures include radiofrequency and carbon dioxide and YAG lasers. And what those do, there's many instruments out there. About 10 different companies have an in-office procedure. And they basically almost necrose the lining of the vaginal tissue, but with thermal damage. So it's the laser, it's very powerful. It's not painful for a woman to actually go through the procedure. Over the last 3 to 4 years, this has been an explosion in this market. And they, I don't know if I should say brand names, but there's plenty out there that use different modalities, Thermiva and Mona Lisa.
That's fine. You can mention brand names as long as, we mention a range of them. That's no issues.
Yeah. So, and I'm not a proponent of any of them necessarily, but they work well. What they're doing is they're just causing thermal damage, which as a dermatologist for lasers on faces, it's a similar idea. You're stimulating collagen formation and vascularity. And for dryness in the vagina, that works really well. You're increasing the epithelial layer of the vagina that thins after menopause. And so those are great options for in-office procedure. They're cash based, and so a lot of women, they can't afford it, and you need to repeat the procedure. So you do 3 treatments, and then a year later you need to go back for maintenance. And so a lot of women don't feel like they want to spend that kind of money. And again, the privacy issue comes up too with a lot of my patients, that they don't really want to go and have that procedure done.
I see. Now, before we get into more of the procedural stuff, something you said caught my attention. You said a lot of women may not be doing their Kegels correctly. Could you talk a bit about that? Because I'm sure I have a lot of my colleagues that talk about it too. I mean, believe it or not, in my residency, I was the only guy there, and so I used to hear all these sorts of conversations. So I'm curious, what is it that makes a Kegel be correct versus incorrect?
So it's actually making sure that they are contracting the correct muscles. So, and that they're not doing, a lot of women think that they're supposed to pulse really fast, but it's actually, and there's different ways that you can actually get an effective Kegel, but it's making sure that the vaginal muscles are contracting. And so, and that the transversalis lower abdominal muscles are contracting at the same time, because they're all related. So it's a matter of, so in the office, I'll oftentimes during a pelvic exam have them perform a Kegel when I'm doing their pelvic exam and instruct them how to initiate those muscles. part of the problem is not just that women can't do that on their own. It's that after childbirth, those muscles and nerves are damaged, and it's actually hard to engage those muscles correctly. One set of the muscles, maybe more posteriorly, will be effective, whereas more distally, they're not.
I see. So if they don't have you as a guide, is there some way that they can make sure that they're learning how to do that properly? Or is there some training guides that they can look at?
Yeah, absolutely. On the internet, there's plenty of access to that information, and it's a good sort of thing that you could have on your forms, just as a reminder. Here's a good Kegel website.
Okay, no, thanks for going through that. Now, in terms of the procedures, yeah, you nicely went through some of the lasers. You're right. Some of the lasers, same for facial aesthetics, or if it's even body aesthetics, just channeling some of that collagen formation and stimulating it to go. And are there, before we move on to photobiomodulation, do you have to take into account things like skin color or skin tone? Are there different side effect profiles that you worry about if someone has darker pigment or not? Is that ever an issue?
No, the vaginal mucosa does not have melanocytes, and so it's not an issue. And then on the vulva, I have not heard anything about needing to be careful with pigment on the vulva or it causing a change in pigment with these laser treatments.
Oh, no, thanks. Yeah, I was referring to more the vulva since that was the outside. I was curious. Okay. So can we talk about then, the photobiomodulation? I feel like this is one of the new age therapies. We're seeing it in all aspects of skincare for sure, like whether it's hair care, it's facial care. So can you talk a little bit about what is photobiomodulation and how is it used, especially when you're thinking about vaginal or vulvar rejuvenation?
Yeah, so again, when we think about a high-powered lasers, as you know, that's doing the thermal damage and then causing rejuvenation of the tissue, right? More collagen formation. And so what low-level light therapy does is it uses red light therapy in a certain nanometer, a certain wavelength, that stimulates the tissues to produce more ATP, and instead of damaging the tissue, it's more stimulating of the tissue. So it doesn't cause cell death, it causes sort of cell activation. And we can get into the biomedical stuff, the cytochrome C oxidase and all that if you want to, but it's just sort of, it stimulates the mitochondria to produce more ATP and stimulates to produce more cell turnover. So what photobiomodulation does is a more gentle form, I think, and less damaging form of tissue rejuvenation.
Yeah, I mean, in terms of the hardcore science, I think what we'll do is in the handouts that accompany this, we'll put the links in there for the articles. And so if people want to read about it, but you're right, it's a really fascinating area because, for a long time, we used to even wonder if low-level light therapy would have an effect or not. But we know that in some of the cellular studies, for sure, these cells are getting activated. Like you say, it is a fine balance. If you go way overboard, then sometimes it can be an issue, but I mean, there's a big therapeutic safety index there, I also feel. So how do you incorporate this into your practice? And, when you talk about all the therapies, where does photobiomodulation sit in terms of, how effective is it in the side effect profile? Curious how you talk about that.
So with my experience with photobiomodulation, we've done some studies on it, and with vaginal tissue in specific. So one study, we looked at stress urinary incontinence, and we had 55 women that joined. They had to have a baby, and they had to have vaginal birth and be sexually active. And we used objective measurements with the pad weight test. And so they would do stimulating exercises with wearing a pad to show that they had incontinence, and we would measure the weight of the pad. They went and used the photobiomodulation at-home device. They used it 3 times a week for 10 to 12 minutes for 45 days. And then they came back and they filled out questionnaires during this time, every week to 2 weeks. And then they came back at the end of the 7.5 weeks, and we did the pad weight test again. And 84% of women had reduced their urinary leakage greater than 50%. And 50% of women had no further leakage. And I was actually very surprised by this data.
Wow.
I was thinking it was
45 days.
Yeah, and but consistent use. So similar to the kegels, it has to be consistent use of this device. And so they had significant reduction in their leakage. They had no side effects. That's one woman had a urinary tract infection because of just not cleaning the device carefully enough, we think, perhaps, or she just had a UTI, I don't know for sure.
Yeah.
So it's the low side effect profile and very safe. During the same study, we made sure that we took a subpopulation and measured the temperature in the vagina after they used it, during and then after. And we did a visual inspection, and then there was no damage to the tissue. And the degrees only went from 37.3 Celsius to 37 point, I believe it was 4.
Oh,
so
yeah.
just a very increase in the temperature.
Yeah, that hopefully shouldn't affect anything. Do you think, were you able to track changes over time, or was it at the very beginning and at the very end with this particular study?
With this study, we did objective measurements in the beginning and the end, and then they filled out subjective questionnaires, the ones I mentioned before, for female sexual function and then urinary distress. And we saw improvement in those at each step along the way. By 2 weeks, we saw improvement in their distress over their symptoms. So what our further study is going to do, we didn't have a placebo arm in that study for a variety of reasons, but we're planning on doing a placebo arm to show that that there's not likely a placebo effect with this device.
And how does the device that you particularly used? Which device was it that you used?
This was something called V-Sculpt, and that's available in Europe and Canada. It's getting FDA approval currently for us to sell it here, but it is available in Canada and in many other countries in the world. The one that's available in the United States is called V-Fit. But to answer your original question, the way I approach it is I give women all the options, and I say, okay, so we can do kegels and pelvic floor PT, surgery, in-office procedures, and one of my colleagues does the in-office procedures. And then I bring up photobiomodulation in the sense of, here's a great technique that you can use at home along with kegels, I think is most helpful, and see what the effect is. And if it's not helpful, then I think it's time to move on to surgery or an in-office procedure. Some of my colleagues are using this device along with sort of as a maintenance treatment after they use the in-office procedure, because they find that women are maintaining their results longer, especially as we age. Our collagen breaks down pretty fast. And so the procedure helps initially in the first 6 months, and then women start to notice their symptoms coming back. And so they're having them use the device as maintenance.
You know what I find really interesting about this area, especially with the low-level light therapy, is that it's one of these things that, like you said, requires just constant daily use, and then there's this gradual improvement over time. I mean, we see this with hair loss therapies. You just got to constantly use it a little bit at a time. So is this something that is pretty easy to use? I mean, does it require a lot of maneuvering, or are there people that you might not say would be a good candidate for photobiomodulation, or in general, is it pretty safe for everyone?
So it's safe for everyone in general. I would say people who are on photosensitizing medications, I would not have them use it. People who've had a history of cancer in the last 5 years, just because it hasn't been studied, we don't recommend people use it for that, especially gynecologic cancer, because I don't know what the true effects would be if you're stimulating cell growth and there's a microscopic cancer there. So we usually say photosensitizing and a cancer history in the last 5 years would not be ideal candidates. Women who are older and have vaginal stenosis, they might need to use a dilator first.
I see.
The instrument it looks essentially like a vibrator, and it does vibrate. And there's some data that vibration stimulates fibroblasts, and you and I had talked a little bit about that.
Yes, actually, that's true. Yeah.
So this device has heat, the low-level light therapy, the red light therapy, and then vibration. And we think the three modalities together is what really makes this a very effective device. So it's very easy to use. It's essentially inserted into the vagina where the red lights are just inside the vagina. So it doesn't have to go all the way into the vagina by any means. The lights are very powerful, and so they can affect the perineum. and the vagina just as it's inserted into the vagina.
And then what would you say, because I see women that have sometimes atrophic vulvar areas and vaginal areas, lichen sclerosis. We see a lot of conditions where women do struggle. And I'm sure you see quite a few of these too as well in clinic. What do you think the role of photobiomodulation is there? And, I don't want to pin necessarily how the device is used, but just generally, do you think photobiomodulation would have a role in low level inflammatory conditions that are in that area?
I believe it will, because we know that photobiomodulation and red light therapy in particular reduces inflammation. And so I've had women use it who have vestibulitis and other vulvar pain disorders. And I've had some, I can't say it's anecdotal, obviously, but I've had patients who've noticed a reduction in their pain in that area. And it's taken some time. It's more of a 3 to 6 month process for them.
I see.
But they were trying to avoid surgery. And so we've done creams and injections and kind of everything. And so they used this and they noticed that their inflammation was decreased. And objectively, I noticed decrease in the erythema, and in the Q-tip tests, less pain. So I do think there's a role. And I think there are some experts in South America that are looking at it with lichen sclerosis. And
really?
I don't know. Yeah. Mm-hmm.
Well, I'm very interested to see what they find then. Are those studies ongoing right now?
Yes, they are.
Oh, great. Yeah, I'd be very interested, because sometimes it's a struggle to, topical therapies don't always get you the result that you need. So
right, and surgery can be quite disfiguring and painful, and so reasons to have other treatment options. One study that we did do, or a physician and I did in South America, Dr. Adrian Gaspar was one of the physicians who did this study. They took biopsies from postmenopausal women after they had used the device. So they had 8 women in placebo and 8 women who used the device. And it's very impressive. I sent you slides of it. With the epithelial lining, it increased in size. There's increased glycogen producing cells, increased vascularization, and collagen formation. And that was after 1 month of use.
In fact, what I was going to do was I was going to put those slides up because I thought that would be pretty interesting to talk about that. So I believe it's that figure. So let me just grab that. So I'm going to pull up some of these figures that you had shown. I think they're pretty impressive. So let me go ahead and get that. And could you walk us through this one here?
Sure. So this is a nice cartoon about what our tissues look like, vaginal tissues look like before menopause. So on the left, you can see that with estrogen in place, the vaginal lining is thick, and there's nice arteries and rugal folds, more plump labia. And then without estrogen on the right, we start to lose the vaginal fornix, so the vagina can shorten. The tissue absolutely gets thinner, and on the right, you can see the far right, how much thinner the vaginal lining is. And what we really lose here is glycogen producing cells, and glycogen is what the lactobacilli feed off of in the vagina and keep the pH at a level that is healthy and keeps a reduction in infection. So atrophic vaginitis is quite common in women with menopause, in menopause. So again, the vagina decreases in length, and there's atrophy of the labia and reduction in blood flow and thinning of the vaginal wall.
And then there was a really nice, from the study, there were some histological samples that you had taken. Is that right? The punch biopsies that you're talking about, was that part of what you had looked at in those punch biopsies?
Yes. So we'd use 16 women, 16 subjects. 8 of them used the device and 8 were placebo. And we did a biopsy at the lower third, the junction of the vaginal mucosa and the lateral wall. And so at baseline on the left, you can see that she doesn't have a lot of glycogen producing cells. Those are the ones with lots of they look sort of like foam cells almost, just lots of clear cytoplasm around the nucleus. And so on the right, you can see the vaginal epithelial layer is grown quite a bit. It's thickened. There's more vascularization. There's much more glycogen producing cells. And this was after 1 month of use. So these women were treated by the physician with the device. And then 2 months later, a biopsy was taken at baseline. And then 2 months later, a biopsy was taken. So even after not using the device for 2 months, they had maintained these changes. So we believe that the histologic changes are what is truly happening with the red light therapy, because we can see the differences in the biopsies.
Yeah, this is very interesting. So what you're saying is that they used it for a month, but they then didn't continue to use it, and they maintained some of the changes that they initially got.
Yep. And that's also what we found in another study that we had done that more was subjective. We didn't have objective data, but women used the device for 180 days. And initially they used it 3 to 4 times a week for the first 2 months. And then they used it once to twice a week as they wanted to for the remaining 6 months. And they maintained their, from 3 to 6 months, they maintained their results with just maintenance use.
Wow, that's great. So, and especially this is an at-home use device. It doesn't require them to come in. So,
yeah, exactly.
That, now, in terms of, now we're talking about pelvic floor and whatnot. Now, is this device useful for sexual dysfunction as well? Is there a role for that in the sexual dysfunction sphere?
So V-Sculpt, again, is approved for stress incontinence and sexual function in the rest of the world. V-Fit is approved I can't even say it's approved by the FDA. It is designated a wellness device by the FDA because, as we know, red light therapy is such a low risk modality. And so it is a general wellness device, and we say that it improves natural lubrication and sensation and improves sexual function. There are no claims about stress incontinence with V-Fit. Again, we're working on getting approval for that, so I wouldn't say that it's technically been proven to do that. I know that my patients say that it has helped, and that it's specifically for sexual wellness and intimate health.
Now, thanks for taking us through the entire sphere of, the background, the clinicals, and then when women come in and they see these improvements, what are some of the ways you've seen just their general mood change? Or, I mean, do their relationships end up getting better? Does their personal confidence get better? I mean, what are some of the changes that you've seen along the way?
Well, as you know, with sexual dysfunction, it affects all parts of a woman. It's the physical, the mental, and emotional, and I'm sure same with men. And so what I'm finding is that women can enjoy their lives more. It can improve partner connection, intimacy, their confidence, absolutely. So women who, lots of life changes cause sexual dysfunction, whether it's having repetitive miscarriages or infertility or just relationship issues or physical dysfunction with dryness. And women come in and they say that things are better and then they feel better. I interviewed every woman in the 55 patient study that we did. And they all said that, not all of them, but most of them said that the device really helped them start thinking about sex more. Their libido was not very high, and that happens in many relationships just with time. And it made them actually start thinking to improve their libido. So even that avenue was somewhat of a placebo effect, truly, that they're just using a device. It helped.
One day we'll figure out what this placebo effect actually is. We'll tease that apart, and hopefully we'll get to the bottom of that.
It's true.
Maybe the functional medicine route will actually give us more tools to understand what's going on there. Come to think of it, to be honest.
Yeah, I'm all about if women are getting better, whether it's placebo or not, then at least they're getting better. But I like the fact that we have good objective data with these devices.
No, absolutely. So I appreciate you going through the science there. Now, if people wanted to follow you or get in touch with you or find you, how can they do that? Whether it's online or whether it's a clinic, or are there avenues to keep track of what you're up to?
Yeah, absolutely. So LinkedIn is a great modality for that. For me, I follow, I put stuff on there, what I'm doing. I'm getting certified in November for functional medicine.
Yay.
Yay. So I'm going to be approaching women with infertility and other gynecologic and hormone issues from a functional approach.
And in terms of functional medicine, are there different ways that you could take functional medicine when it comes to women's health? I'm assuming you're focusing on fertility, but in OB-GYN in general, are there different sorts of practitioners that have different focus areas within functional medicine?
I think with OBGYN, I think there's not a lot of OBGYNs who are functionally medicine
That's
trained.
true.
I think you're the
I'm
only
sure.
one. Yeah, in the state of Washington.
Is that right? Holy cow. That's amazing.
Yeah, it's just, we're so conventionally trained and with medical school that it's, and I think I did the same thing. I sort of, just put aside integrative approaches, but they work, and it's what patients want. They want a more integrative approach. So that being said, I think as an OB/GYN, we do treat the whole woman. We treat pregnancy, gynecologic issues. And so even if physicians just take the approach of lifestyle incorporating into all of that, then that's at least a start. Thinking about when you're pregnant, what are you putting into your body? It's so important. And how are you feeding your baby? And the microbiome, I'm just a true believer in that, with so many things to do with prenatal and postnatal health.
Absolutely. Oh yeah, that's like the next frontier, I feel like. Of course, I'm a little biased being a researcher in the area myself, but I'm really excited about what's to come there. Well, thanks for spending a bit of time with us today. I feel like I learned a lot about just the approaches that you take and what's the role of photobiomodulation. I think hopefully a lot of women find this both educational but also informative of actually thinking about steps and solutions that they may discuss with their physicians and practitioners.
Yeah, I think the more treatment options women have, the better. I mean, we just to keep pushing that frontier. What else can we give for women?
Exactly. Well, thanks so much.
Welcome. It was fun. Thank you.